Well, welcome back, everybody. I hope everybody had an opportunity to stretch and grab a glass of water to get refreshed. I'm going to actually introduce Trish Whetstone that will be introducing our next speaker. Trish Whetstone is our Director of Program Services at Prevention Work. So Trish, take it away.
Thank you, Mel. It is my pleasure to introduce Ann Hazlett. She is the Senior Advisor for Rural Affairs at the White House Office of National Drug Control Policy, or the ONDCP. I see why we have that acronym, that's a bit of a mouthful, where she is working across the federal government to equip rural leaders with tools to address drug addiction in rural America. That's great. Before joining the team at ONDCP, Ann served as the assistant to the Secretary for Rural Department at United States Department of Agriculture. In this leadership role, she developed and led the department's response to the opioid crisis, including greater access to behavioral health care in rural communities. In addition to her service at the Department of Agriculture, Ann has worked on Capitol Hill as legal counsel for the agriculture committees in both the U.S. House and Senate. She has also served in several state leadership roles, including Director of Agriculture and Chief of Staff to Indiana Lieutenant Governor. Ann is an Indiana native and a graduate of Kansas State University. We're glad to have you, Ann, and with that, I'll hand it over to you.
Thank you so much, Trish. Well, good morning, everyone. It is truly an honor to be here today and to have this chance to share some thoughts about building strong and healthy rural communities. I know that this is a passion that I share with each of you that are participating in this event today. This is my first Hope and Healing conference, but having said that, this part of New York State has a long and special place in my heart. My family has actually come to Chautauqua Lake each summer for 4 generations now. So since I was a very young girl, I have known the beauty and the hospitality of this region. However, over the past 2 years, I've come to know this region and many of you in a different way, and that is as partners in our mission to save lives. I think it was just over a year ago that I spent 2 amazing days in Chautauqua and Cat counties. I started that trip visiting with the team at the Council on Addiction Recovery Services in Olean. I toured the Chautauqua Center in Dunkirk, and I got to meet with many of the Hope Chautauqua Coalition members and other local leaders in Mayville. And in those visits, I was struck by the work that has been done here to help people who are struggling with addiction find hope and healing. But I think perhaps more importantly, I was greatly moved by the spirit of partnership in which all of this great work is being done. That's been a year, and I can say literally thousands of miles of travel since that time. But when I look back, I can say without question that you have so much to be proud of here in Western New York. You face a great challenge in the impact that addiction has had on this region, without question. But you are facing that battle head on with partnership and with innovation. And in that, I am incredibly grateful for this opportunity to share and to learn from you in this virtual conference. Combating the drug epidemic is a top priority for the Trump administration. This starts really at the top with the president who lost his own brother to struggles with alcohol. I work for Director Jim Carroll, who is the United States Drug Czar and leads our team at the Office of National Drug Control Policy, otherwise known as ONDCP. We are an office within the White House, and our mission is to coordinate the activity and all of the spending that goes on drug activity across the federal government. This is a complex task, but we really have a simple mission in everything that we do, and that is to save lives. I think much like you have done here in Western New York, Director Carroll has driven an all-hands-on-deck approach to meet this mission, pulling in everyone from the Department of Justice and Health and Human Services to the Department of Education and the Department of Agriculture. And while we are seeing signs of progress, there is still so much work to be done. Our efforts are coordinated around 3 core priorities, and I'm going to share a bit with you this morning about that work. Our first priority is working to prevent drug use before it even starts through education and evidence-based prevention activities. As you know, working in this space, research shows that addiction is a disease. It's a disease that can be prevented with information and protective measures to reduce the risk of substance misuse. Here, the administration is taking action to warn youth about the dangers of opioids and other substances through a national media campaign called The Truth About Opioids. But this is about much more than talking to children. We are also focused on implementing safe prescribing practices, expanding the use of prescription drug monitoring programs, increasing the options for drug disposal in communities, and strengthening the capacity of local coalitions to prevent substance misuse. For example, in New York, the Office of National Drug Control Policy has provided funding under the Drug-Free Communities program. This money is used to build community coalitions around reducing substance use in local youth. Last year, $7.3 million was awarded to 59 coalitions across the state, and 9 of those are right here in Southwest New York. In the area of safe prescribing, much of our focus to date has been around reducing the amount of opioids prescribed, and we are seeing those numbers move in the right direction. Nationwide, we believe that opioid prescribing rates decreased by almost 34% last year. And we know that there is still a lot of work to be done here. We're working closely with our partners in the medical education community to continue to move that needle in the right direction. But we're also expanding this focus to include increasing co-prescribing of naloxone with an opioid, as well as bringing attention to the dangers of co-prescribing opioids with other medications, such as benzodiazepines, that of course increase the risk of an overdose. Our second priority, in addition to prevention, is to reduce the availability of illicit drugs in the United States. As you may know, nearly all of the illegal drugs killing Americans are produced outside of this country and trafficked across our borders. So to stop the flow of these deadly substances into the United States, the administration is taking bold actions on a wide range of fronts, from combating sales of these drugs over the internet, to working with our international partners to disrupt that production and supply chain and keep the substances from even coming here. And then lastly, a lot of this is moving through our postal system. So we've had a big focus on strengthening that infrastructure for intercepting drugs that are being shipped through the mail. Beyond these actions, we are also building the capacity of our law enforcement partners to combat drug trafficking. Last year, Director Carroll added Oswego County, New York, to the High Intensity Drug Trafficking Area Program, otherwise known as HAIDA. This designation was made after a request from local law enforcement and, of course, support from state officials and members of the New York congressional delegation. I flagged this for you because this was one of only 13 designations that were made nationwide last year, and it is significant because it will enable Western New York to access even more resources for enforcement, prosecution, and drug intelligence, as well as prevention. In addition to law enforcement with respect to supply, we are working closely with the business community to stop the flow of illegal substances into our communities. As drug trafficking becomes more and more sophisticated, the business community and that private sector has an important role to play in this fight. Last year, the White House released a set of private sector advisories that were intended to help businesses better protect themselves and their supply chains from inadvertently supporting the trafficking of fentanyl and its precursor chemicals. This is an important first step, and we will continue to look for ways to foster that public-private sector collaboration to curb the production and the distribution of illicit drugs. Finally, our third priority in the administration's strategy to defeat the addiction crisis is really a focus on those who are currently struggling with this disease. How can we increase access for them to treatment and recovery services that they need to live a whole and productive life? Like any other chronic disease, we believe that someone who wants help should be able to get help quickly and then be supported with those wraparound services. We also know that in addition to saving lives and helping the person who themselves is struggling with addiction, when we focus on treatment and recovery, that will benefit the families and communities that are literally torn apart when this disease goes untreated. This effort has many facets, and some of the things that I want to flag to you here are efforts to train healthcare providers around how to better screen for substance use disorder and then refer patients to treatment, increasing the number of healthcare professionals who can provide addiction treatment, so important, especially in a more rural setting. How can we better leverage drug court and diversion programs to get more people into treatment? And then we've had a big focus on the recovery community, looking for ways to increase employment opportunities for people in recovery and expand access to peer recovery support services. With that broad overview, I now want to take a few minutes to share some tools that we have built specifically to empower local leaders in rural communities with data and with knowledge to help them take local action. From coast to coast, we know that rural areas like much of Western New York lack many of the resources that are needed to keep people healthy, things that would be a commonplace in, say, New York City. These are assets like treatment centers, mental and behavioral health counselors, support groups, and transportation. We also know, as importantly as recognizing those gaps, is that the most effective solutions to meeting those needs start at a local level. They don't come from Washington, D.C., and honestly, they often don't come from a state capital. So to help local leaders build that effective local response that will work in their county and their region, we have focused on developing a number of resources to help them with this work. Each of the tools that I'm about to drive by, so to speak, are available online, and you will find a slide with links to each of those tools in the conference virtual resource folder. I want to start with a community assessment tool. One of the things that we learned so early in this work is that there is a dire need for local data around this disease. There's a lot of numbers that you can get from a federal level. There's even numbers from a state level, but most local leaders need to know what is the scope of that problem in their community in numbers. And so to do that, we built what we call the community assessment tool. This again is a web-based tool. It provides county level data for the entire country about drug-related deaths and overlays that data with information about some of the socioeconomic factors that might be driving those local trends in substance use. Things like education levels, disability rates, and unemployment. We are currently updating the tool with additional data sets on things like broadband availability, transportation, health professional shortage areas, and persistent poverty designations. We know that all of these factors have a direct impact on rural prosperity. One of the things that I love about the tool is that the data prints in a very simple and user-friendly format. It's really meant to enable a local discussion. It comes out in a one-pager that a county council or just a group of concerned leaders can sit down and look at in a very simple format. And again, it's meant to enable that local discussion or even establish peer relationships. You can pull up your county and see what's going on, and then look at 2 or 3 counties over and see why the results might be different in that location. So once a local leader knows the scope of their problem in their county, in their community, in that region, the next question, of course, is what do I do about this? So the next tool that I want to talk with you about is known as the Rural Community Action Guide. This product was released in late January. It was an effort by the Office of National Drug Control Policy, but we teamed up with 18 rural stakeholder partners to launch this guide. There's everyone included in this, from the National Association of Counties to the National Sheriff's Association, CADCA, and the National Rural Health Association. The guide offers background information, recommended action steps, and success stories on a wide range of topics related to addiction. The vision for this guide really came about when 2 years ago, I was at the Department of Agriculture at the time, and we began a series of roundtables in rural states to learn about the impact of addiction in rural America. We spent a lot of time with state and local leaders understanding what this was doing to their communities. We asked a lot of questions about how the administration could be a strong partner in that local response. And then perhaps most importantly, this was a time for us to learn about what was working to save lives. And what we found is at the same time we were doing these conversations, many of our rural stakeholder partners were also out on the ground learning and mobilizing resources to fight this epidemic. And in all of these discussions that we were having, as well as our partners, the same question kept coming up virtually every time. And that was the question of what is working. And so from the answers to that question, this vision for a rural community action guide was born. You will find that the guide covers 15 different topics related to addiction, everything from stigma to housing, rural broadband, and the use of the engagement of the faith community. For each topic, there's some background information to help ground that local leader in the scope of the issue, but then some recommended action steps and promising practices as examples of success that have worked in another community and that local leader might consider replicating in their region. The material for each topic in this guide was again written by a contributing partner organization, not by the government. And the reason that we did that is because these partner organizations, whether it's the National Sheriff's Association or CADCA on the prevention side, they're the experts on the particular issue that they wrote that section about. You will find a fact sheet, again, in the virtual resource folder that has a list of the topics that were covered and the contributing partners that were part of the guide. Again, this information is presented in a very simple, user-friendly format, and it's meant to support that local leader who may know very little about this challenging issue as they get started in their region. The guide lives on a rural opioids webpage. This is a page on the U.S. Department of Agriculture website, and you will find that it is further enhanced by a set of promising practices for each of the topics that are covered. They include dozens of success stories from many different sectors and different states. In February, Director Carroll began a series of additional roundtable discussions in rural states that have been significantly impacted by addiction. We started with an event in Southeast Missouri with Governor Parsons. And once our country has recovered from the COVID pandemic and life returns to a more normal pattern of travel, we hope to continue these discussions in other states, both to highlight the guide and the needs of rural communities in addiction. So once you know the problem and what you want to do about it, local leaders are then looking for how to pay for that solution. So the final product or the final tool that I want to highlight for you today is a federal rural resources guide. There are so many federal programs out there right now, and many rural communities are overwhelmed trying to use them. They don't have a grant writer on their team, on their staff, and trying to navigate all of the different buckets that are available. How to apply, when to apply, what to apply for can be extremely overwhelming. So in 2018, we sat down and really looked at how we could build or ease the access of local leaders to get to these resources and help them, again, navigate all that is available. And to do that, we built a federal rural resources funding guide. This is meant to be a comprehensive overview, truly a one-stop shop of the resources from numerous federal departments and agencies to help rural communities with drug addiction. What I like about the guide is that it's written through the lens of that local leader, not through the alphabet soup of all of the different federal agencies. You can go to the guide, look at what it is that you are looking for to access, and then get directed to the federal agencies that might have a program that fits what you're trying to do. I want to underscore this tool because we are literally days away from launching a very exciting update to the guide. It will not only include new funding opportunities that have come about since late 2018 when this was developed, but we've taken what's currently a PDF document and transformed it into an extremely user-friendly website. And I know given the need for additional resources right now at that local level because of the COVID pandemic, we are very optimistic that this tool will be even more valuable to local leaders in many rural places. So before we open things up for some time for question and answer or discussion with issues that you're seeing and I can learn from, I do want to take a few minutes just to touch briefly on the COVID pandemic and what steps the administration has taken to support care for substance use disorder during the public health emergency. From day one of the pandemic, Director Carroll has given our team one very clear charge, and that is to do all that we can to ensure that people do not lose access to care for treatment and recovery needs to support their struggle with addiction during this pandemic. We know that the addiction crisis has not gone away. It's simply now intertwined and in many cases magnified by COVID. So without question, I know that that same commitment is here in Western New York. I got to talk to Kelly Potter earlier this week, and in her words, we quote, haven't missed a beat. I think, the fact that you've moved this Hope and Healing Conference online is a testimony to her words, but I've learned also about heroic acts by local partners in this region. Everything from delivering naloxone to providing harm reduction services by appointment, meeting with people who need support during this time on Zoom and other virtual opportunities, and even recording videos to ensure that prevention messages are still reaching school children, even though school is not in session. So even in the face of great uncertainty, truly taking it day by day, you are continuing to work as partners and to get the job done. We want to support you in those efforts. And some of the actions that have been taken to do that, I want to highlight for you this morning. One of our first focuses have really been with each of the drug-related agencies to see what flexibility in their policy was possible. Flexibility that would ensure, again, that maximum access to treatment during the pandemic. One of our big focuses has been around telemedicine, and there have been huge steps taken over the past 2 months to empower and expand telemedicine. The Drug Enforcement Administration, as well as SAMHSA, the Substance Abuse and Mental Health Services Administration, have both taken steps to allow providers to prescribe medication-assisted treatment to both new and existing patients through telehealth and even over the phone where telehealth is not possible. DEA is also allowing providers with a DEA license to prescribe to patients who are outside of the state where they are registered. This again allows providers to work across state lines through telemedicine. And lastly, CMS has expanded Medicare coverage of telehealth services. CMS is also allowing opioid treatment programs to provide counseling using telephone calls rather than the two-way interactive audio-video technology. Again, recognizing that in rural areas, care might be needed and that technology is not always available. In addition to the telemedicine focus, there has been significant changes to ensure that there is continued access to medication-assisted treatment. For methadone, SAMHSA has been allowing states to authorize that opioid treatment program to give stable patients up to 28 days of take-home doses, and for less stable patients, even 14 days of take-home doses. In addition, DEA has been allowing for transportation of methadone to patients who cannot come to the clinic. Finally, in the area of flexibility, in addition to telemedicine and access to medication-assisted treatment, CMS has provided flexibility to states in how they use their Medicaid resources through what's known as the Section 1135 waiver process. That waiver process can be used for many purposes, and I won't go into that today, but I want to flag that that's been another tool to expand the use of telemedicine. Beyond flexibility and policy, the administration has also created numerous resources to address some of those key questions and collateral consequences that we know are stemming from the pandemic. I'm talking about things like online recovery supports, domestic violence assistance, and even telemedicine basics that are needed both for patients and providers. And last but not least, beyond that flexibility and the resources, there has been substantial funding made available to support the need for prevention, for treatment and recovery services during this public health emergency and the recovery period that will follow. This includes funding for things like the needs of rural hospitals and health clinics, telemedicine connections and equipment, and transportation. Many of these changes, resources, and funds cut across different federal agencies, and the changes have come out so quickly, they're challenging for someone even based in Washington to be able to keep up with. So ONDCP has created a fact sheet, which I think you may find helpful to navigate some of the major actions that have been taken, and a copy of that fact sheet, again, can be found in the virtual resource folder. With that, I would like to now close and move into answering any questions that you might have or any perspective that you might wish to share. But in doing that, I'd like to leave you with a final thought of hope that I think is very fitting for the theme of this conference. I've been working on rural drug addiction for almost 3 years now. And when I think about the lessons that I have learned in that time and the communities like Chautauqua County that I've had a chance to learn from, one of the biggest lessons that I have learned is that if there is any silver lining in this crisis, it is the catalyst that this crisis has become for broader change in many rural places. This crisis has propelled leaders like many of you to tackle difficult and underlying changes in a new way. Whether we're talking about workforce training or infrastructure, education, modern healthcare access, there are often upstream drivers that need to be addressed, quite frankly, regardless of the drugs, to build places of health and opportunity, not just for today, but also for the future. And in that transformation, I find great hope and an enormous opportunity for all of us to cast a new vision for a brighter tomorrow. So thank you for your leadership and the invitation to be here today. I look forward to your comments and your questions.
And we would like to remind participants that you can pose questions in the question and answer section that you have as part of your Zoom setup. And we invite you to send questions during the presentations and not just at the ends of presentations as you have them. There may be times during the presentations that we can take a moment to answer them, and we do have moderators, producers standing by to help keep up with that. So feel free to post those as you have them, and we'll be sure to share them with our presenters. We'll say that that was all very well said, Anne, and I wish that I had some questions, but I think any questions that I did have were answered pretty thoroughly as you went through. We do have one from Steve Kilburn here, who's saying, "Hi, Anne, thank you so much for your participation in our conference today. We look forward to your next visit to Chautauqua County. The question is this: do you anticipate some of the regulatory changes made during the pandemic to remain in place after the crisis is over, such as more telehealth?" That's a fantastic question. What's your take there?
Thank you, Steve. It's great to hear from you, and I look forward to connecting with you and many of the other faith leaders on my next trip back to the region. It's a great question, and it's one that we've been hearing frequently. Many of the flexibilities are currently set to expire at the end of the public health emergency. However, there have been so many positive lessons that we have been hearing and stories of people being able to access care. I've talked to rural leaders in multiple states where treatment numbers are up because, as many of you know firsthand, some of the barriers that we have in accessing treatment when we don't have these telehealth flexibilities are transportation and time. And with both of those barriers being taken off the table by telehealth, we've actually seen greater numbers of people going into treatment. So there is a robust conversation going on right now about the merits of some of these changes. The agencies will be doing some evaluation of what those results have been, and I believe that there will be a discussion about what should remain in place and what was truly appropriate just for the time of this public health emergency. But as you see those lessons learned in the region, please be certain to be sharing those with your congressional delegation and any other contacts that you currently have into the federal agencies in this space, because all feedback is important and will be very much welcome.
All right, thank you for that. We have another question here from Beth Stark. She says, thank you for all of the information and for joining us today. As an early childhood expert in our county, I am interested in you speaking more about the interaction between your work and the field of early childhood.
Yeah, that's a very timely question as well. One of the issues that I have been hearing more and more about in my time on the road is the impact of substance exposure in families and in children, whether they were exposed in utero or born healthy, but then are in a family where substance use is present, and the impact of that now then as we are seeing as many of these children are becoming school age and going into grade schools in particular, are many of the partners that I've been hearing from school systems that are overwhelmed by how to help these children, teachers that aren't prepared for that mission. And these kids have probably always been in communities, but they are certainly here in greater numbers now as a result of the opioid epidemic. And so we are in the process right now of having many conversations with folks that are in the early childhood field, whether they are federal agency partners, state agency partners, or folks that are out doing this work in communities, better understanding some of the services that are currently in place, what is working well and could be scaled up in other places, but I think most importantly, looking to identify where those gaps are. We're looking at doing a convening later this year to begin a dialogue about that, those gaps, and then we'll look at some of the action steps that need to be taken after that initial convening. But I would love to connect with you after this conference and get that perspective on what you're seeing in the region.
All right, thank you so much. Let's see here. We have a question in the chat here from Teresa. She says, thank you so much for this informative webinar. Would also be interested in learning more about supporting law enforcement's well-being. Okay, training, education, awareness. That could be a general question for us as panelists to send out some more information, unless there is something that you would like to say about that. Supporting law enforcement, training and education and awareness, any of those topics?
Yeah, I appreciate the question, and I mentioned the HAIDA program, the High Intensity Drug Trafficking Area Program. This is something that really enables us to pour extra resources into a county or region, and Chautauqua County is a HAIDA county, and have really enjoyed working with the leadership there. I think that the addiction, specifically the opioid epidemic, has really highlighted that this addiction is a disease, and that something that we can't arrest our way out of. And so one of the things that I've really enjoyed in my time at ONDCP, and I have seen become a growing dialogue, is how to better link some of the law enforcement side of this issue to the public health side. And I know that that is that intersection and finding new partnerships and innovation that's working in one community that could be scaled in another is something that is an ongoing focus for our HAIDA team, and that they'll be working with the different HAIDA regions, including New York.
And I will add to that, just kind of in a general sense, there was a link shared with the a link to the information that we have for this particular conference. There may be some information in there that could be applied in some of the situations that you were asking about, Teresa. And I'm sure if any of our panelists or anybody with Hope Chautauqua or Prevention Works has some additional resources that they have to help answer that question, we can update that drop zone, or even look to contact you or reach out after this conference. So thank you for that, and thank you for your answer, Ann. Right, I am looking currently at our question and answer box, and I don't see anything currently. We can give it another minute there. See if there are any last minute questions. Otherwise, that might do it. Is there anything else? I guess this is going to be a weird question, but I'm going to ask it anyway, just in case it triggers anything. Is there anything specifically that you want to say that maybe, you know, from a personal standpoint that wasn't said in the presentation? I know probably, I hope most of it was in there, but any things in particular that you would want to add, or, you know, things that you want people to know very specifically that maybe doesn't get said enough?
Yeah, I have the great fortune of kicking off your day here and being being the first speaker. And so I want to again highlight something that I think I stated as I opened my comments. You have something incredibly special here. And I get to say that because I work with communities across the country, but the level of partnership that exists in this region is truly outstanding. And you know, Kelly and I were talking earlier this week about the power of partnership, and wow, does that get put to test when you face something like the COVID pandemic, not just the initial public health emergency, but the trickle down consequences that we know are here for the connection between stress and addiction and mental health. So I just want to encourage you in the amazing work that's being done here to build those networks. There's going to be new challenges and new opportunities to innovate, but from what I see when I get asked what is working, I find myself coming back to, you need to address stigma, you need to have leadership, and you've got to have coordination and existing activity, which is what partnership is all about. So you're doing an amazing job at that partnership piece, and I think all of the rest is details. And so just encourage you to keep focusing on how can you strengthen the network, who isn't at the table that should be, and keep down that path. It's critical. It is a critical foundation piece to all of the work that comes.
Thank you very much for that. We have two questions here. I'm going to skip over one for now just to make sure that I am asking the right person, because it could be another general question or for you specifically. In the meantime, we have a question from Brent, who's asking, has there been pushback from health insurance companies about the expand flexibility and use of telehealth? And do you think it will remain an affordable option? It was expensive prior to COVID. Do you think it will, continue to go up? What are your thoughts on that?
We have heard anecdotally about some challenges with some of the expansion around telehealth. I won't say outright, rejection of services, but maybe complex paperwork that needs to be addressed. So where we've been hearing of those situations have been making contact with the appropriate leaders. But I think that, the administration has an opportunity. Oftentimes the behavior of commercial payers is often set by what is the government doing, how is the government treating those services. And so some of those steps that CMS in particular has made to create that flexibility with reimbursement, who can be an originating site, all of the details that I am not equipped to handle and we don't have time to discuss today. They get complex quickly, but there has really been a focus on how can we use technology to increase access to care, and I don't see that going away.
All right, thank you very much. Alrighty, so here's what we'll do with this last question then, while we wait to see if anything else comes up. This comes from Natalie, and this could be for you, Anne, if there's something that you would like to say to weigh in on it. If there are any panelists as well who would like to jump in, who have been currently waiting, we welcome your take as well. Are there any unique issues that you are seeing with addiction at rural colleges? And again, I think this could be more of a general question, but while we're waiting for anything else to come in, do you have any thoughts? And would any other panelists like to maybe post something in the chat or respond to that?
I can throw, I can add some perspective, I think, from the work that we are doing that ties to that college and university setting. There was an event that was held last fall in the White House. Director Carroll hosted an event that was to really meet with university and college leadership around the importance of providing a setting where addiction can be treated on a campus, and that a student who comes that is in recovery can be supported with the services that they need to maintain that sobriety. A specific focus in that discussion that's of great interest to our team under Director Carroll's leadership has been the availability of naloxone on college campuses. And just getting to see this issue implemented or carried out across broadly colleges and universities, I know that it can often be a challenge with resources. There can be stigma sometimes, or at least hesitancy by leadership about what does it mean if we have naloxone on campus? Are we saying then that we have a drug problem? This gets complicated quickly, but I know from what I do every day working with rural communities that oftentimes rural organizations, rural entities have fewer resources. So if anyone is listening that's affiliated with a rural college and this has been an issue that you're trying to navigate and you're looking for help getting connected to resources, please reach out. I would love to work with you directly on that issue, because again, the availability of these services on a college campus is something that is of great interest to Director Carroll and our team.
All right, thank you very much.
Yeah, thank you, Anne. And I wanted to address a question that Teresa put in the chat box about regarding mental health and suicide prevention resources. And I would say, Teresa, that you would like to, if you can, it would be really beneficial for you to stick around for our next training, which is going to be Talk Saves Lives with Victoria Patty. And she is part of the Chautauqua County Department of Mental Hygiene and really focuses on suicide prevention. So I'm sure if you stick around, that you can get a lot of different resources from that training. But if you wanted to add anything to that, Anne, she was asking if you had any suggestions or groups of people you could be in contact with, kind of connecting communities around mental health and suicide prevention.
Thank you for that question. This is not something that I have been working with directly, but there are many resources that have been put out during this time, specifically from SAMHSA around suicide and the broader mental health question. And so I would love to follow up and make sure that you're aware of the specific funding opportunities that are there.
Fantastic, thank you. Thank you so much. If there are not any other questions or comments in the chat box, we don't see anything else in the Q&A. Thank you so much for your participation, your great questions for Anne, and thank you, Anne, for your amazing answers and all the great insight and information that you provided for us today.
Thank you.
Yes, thank you so much, Anne. We really appreciate you participating in our Hope and Healing Conference this year, and hopefully you can join maybe live next year. Wouldn't that be great? So thank you. Before we take a quick break, I did want to go over just our shared folder so everybody is aware that was sent in the chat box, but I am going to share my screen so everybody can get an opportunity to see what they will be accessing once they are in the shared folder. So you can receive the agenda. I know we've received several questions in regards to not having an agenda, so we apologize about that, but if you go into the shared folder, we do have the entire schedule, which I will pull up so everybody can kind of take a look at what the rest of the day looks like. So next we have Victoria Eckert now. Used to be Victoria Patty. She just recently got married, so congrats to her. And so she will be doing a Talk Saves Lives training. Then we will have the Fred Talks with Steve Kilburn, Stephen Cobb, Kelly Potter, Annie Rosenthal, Patrick Swanson, and Deb Maggio. And then after that, we will have Trish Whetstone and Alex Rodriguez, which is helping us be moderators today in technical issues. They will be actually presenting the new trends, CBD and Kratom. And then we will also be switching over to Melissa from Partners in Kind and MP Speaks. She will be doing a presentation called Seeing Trauma and the Roots of Mental Health Disorders. And then last but not least, we have Kevin Dahlgren from Tobacco Free CCA doing vaping and nicotine addiction. And then we will have closing remarks from Steve Kilburn and Misty Pennington from the Chautauqua County Department of Mental Hygiene. So that is one of the things in your shared folder. You will also receive some information. There's a faith-based addiction response ministry. There's a video in there, so you can check out a little bit more about their resources and what that is all about. There are a couple resources in the Fred Talks folder. We also have a few PowerPoint presentations in there that you can access during and after the Hope and Healing Conference, so please be sure to check those out. And there are a ton of resources in the Mental Health and Wellness resource folder, so please access and use these, and feel free to print and use at your discretion. And then certainly not last but not least is our substance use prevention folder. I do want to mention also that there is a survey that we are asking everybody to please complete. So if that was sent also in the chat box, we'll be putting that throughout the whole day. So if you're only here for the morning, if you can please make sure to go in and complete that so we can improve for next year. And then if you're here all day, that's fantastic. We'll be continuing to share. It's the same evaluation form, so please forgive us for sharing it multiple times, but we want to make sure that we get the best feedback so that we can improve every day. I do want to give a huge thank you again to Anne Hazlett and her team for joining us today. We really, really appreciate it, spending time with us here in Western New York. So with that, I just want to mention a little bit before we break. I received a question on talking about the importance of the Hope and Healing Conference and why we do this every year. You know, we've been doing this for several years now, and we really feel it's important to collaborate with partners throughout the county, whether it's prevention, treatment, recovery, mental health services. It's really important for us all to come together because we're all here in the same mission, you know, trying to build that healthy community and save lives. We've seen an uptick and an increase in overdoses throughout Chautauqua County and probably in the Western New York region as well. And we feel this is important to provide resources to the community as well as professionals. It's so important to continue to advocate for substance use field, and we appreciate, and mental health field, and we really appreciate everybody's participation. So with that, we are going to take a 15-minute break. Again, go ahead and stretch, grab a glass of water, check outside. It's sunny and beautiful, at least here in Chautauqua County, and then we will be back on the hour at 11 o'clock. Thank you, everybody.